we are going to talk about interleukin-1. Interleukin-1 is a lymphocyte activating factor. It affects nearly every cell type and often in concert with another pro-inflammatory cytokine like tumor necrosis factor. There are two distinct forms of interleukin-1, which are interleukin-1 alpha and interleukin-1 beta. Both of them bind the same receptor and induce similar biological activities. They express as large precursor molecules from which the major polypeptide is released by proteolytic cleavage. Both are globular proteins composed of 6 strands of antiparallel beta pleated sheets forming a barrel. The image below is the 3D structures of the interleukin-1.
Hi everyone, in this slide we are going to look more details on what are the main biological activity of interleukin-1 and how does this biological activity conducted. So let us look at the first biological activity, which is inflammatory response. Inflammatory response is very important and is help in wound healing. So interleukin-1 increases the expressions of adhesion factor on endothelial cells to enable the transmigrations of immunocompetent cells such as phagocytes, lymphocytes and other to the sites of infections which cause inflammations. Then these inflammations will help in wound healing. Besides that, interleukin-1 is also important in cell growth and differentiations of hematopoiesis cell. So, in other words, interleukin-1 also help in the blood cell formations. This is important for the patient who having bone marrow transplantations because by injecting or consuming interleukin-1 can prevent the patient losing so much blood during the surgery. So how does this actually happen? How does this actually work? Interleukin-1 can increase the fetal liver hematopoiesis or progenitor cell activity and promote the hematopoietic cell survival. So, in other words, the patient will have high level of blood cell in their body if they are consuming or injecting interleukin-1. Thank you.
Let us continue with interleukin-1 biotechnology. The only FDA-approved drug of interleukin-1 that existed on the market is anakinra and Kineret. So how to develop this? This was mainly focused on clinical investigations such as stimulation of immune response, and this can restore hematopoietic process due to most of the therapy that cause damage to the immune system. And this can anti-proliferation against human tumor cell line, no matter in vitro or animal based. But there's also some problems, which is there's no obviously anti-tumor response and recovery of platelets. There's also kind of pyrogens that can cause fever. Besides that, there is also can cause capillary leakage syndrome and hypotension if the administered dosage was inappropriate. So what is anakinra? Actually is a recombinant drug of interleukin-1 that able to treat rheumatoid arthritis. It can bind and block to the interleukin-1 receptor and prevent interleukin binding to it. So it's also known as native interleukin-1 receptor antagonist. So how it works? Basically, interleukin-1 can bind to a receptor and cause signaling and cause activation of immune response. But these things, anakinra, can bind to a receptor as well, but prevent the binding of interleukin-1 to the receptor. Thus, there is no signaling and activation being blocked.
Now I'm going to talk about the side effect of Kineret. The first one, higher chance of infections, as Kineret will affect our body immune system and it will decrease the number of white blood cells in our bodies, especially neutrophils. Thus, it will lower the ability to fight infections. Second one, allergy, especially to those who are allergic to proteins made from E. coli. The third one, injection site reaction, such as redness and irritation, and the reaction will take up to 14 to 20 days. The fourth one, gastrointestinal tract, such as nausea, diarrhea, abdominal pain. And the fifth one, respiratory tract. It will cause flu-like syndrome, infection, pneumonia, and tuberculosis. The last one, skin problems. It will cause mycosis, erythemosis, and melanoma.